Good evening. Thank you for watching Dr. Make Me Beautiful. I'm your host, Andrea Housand, and I'm also the practice coordinator for Derek Jones Facial Plastic Surgery. And tonight we have a special guest here with us, Dr. Derek Jones, my boss, and Nora Wheaton. Hi, Nora.
Hello.
Thank you for coming on with us.
I'm happy to be here.
Yeah. How long have you been in Pensacola now?
Total of about 15 years.
Yeah. Did you have a hard time finding us tonight at the Blab Studios?
No, actually, fortunately, I have MapQuest in my car, so I just
I know, you were
the
just like-
address.
Yeah.
Made it right here.
Very good. If anyone's watching for the first time, my boss, Dr. Jones, is double board certified in otolaryngology and facial plastic and reconstructive surgery. And I'm curious to know, and I think you might have told us this before, but how did you hear about Dr. Jones?
There's a wonderful lady who does my cosmetic tattooing. Her name is Trinket Parker.
Yes.
She does beautiful work. I asked her about referrals for a plastic surgeon because I had been online looking and reading and all of the general research that one does or should do when they're going to have plastic surgery. And Trinket told me that Dr. Jones was the only plastic surgeon who she does not usually have to do any kind of touch-up work for.
Yeah.
She didn't tell me anything about anybody who does, so, you know.
Yeah, and as far as the
Which is
touch-up
nice.
work, that's when they're touching up with scars, right?
Yeah, any of the incisions, I guess, in the hairline where it's the hair's not growing, or
We can't even see yours.
that's because I have a
Saying.
wonderful plastic surgeon.
Yeah. But before we get into your journey and how you came to us, we're gonna go over some of our upcoming events. We go around town. We have a place in East Hill that we go to, Chastain Salon. But I'll stop there and let Dr. Jones take over.
Let's go to our PowerPoint here. We can talk a little bit about what we're going to do between now and the end of the year. So save these dates. If you want to come see us in Pace, we're going to be there on October 31st.
Halloween.
Yes, we like to call trick or treatment.
That's right, trick or treatment.
That's right.
That's catchy.
So October 31st, we're going to be there the morning of the 31st, so you don't really have to worry about any bruising or anything like that because that night is Halloween and you fit right in with your costume. So, but we'll be there on the 31st, the morning of the 31st. If you want to have an injectable, treatment performed at that time, come give us give us a call and then come see us in Pace. You can call the salon at 994-2104, or you can call our office at 484-FACE. So 484-3223 is our number. So come see us in Pace on the 31st. We're going to be in Gulf Breeze at the end of November.
Right
this is
after
going to be,
Thanksgiving.
the Wednesday after Thanksgiving on November 28th. We're going to be in Gulf Breeze, and so if you want to come see us there for an injectable treatment to get you ready for the holidays and things like that, just come see us in Gulf Breeze. We're going to be at Jacobs Chiropractic. We've had a great relationship with Dr. Jacobs and Kim and all the great people there. So give us a call again, 484-FACE, 484-3223, to schedule an appointment to come see us in Gulf Breeze, November 28th. And if you want to keep up with us, you can keep up with us on Facebook. That's an easy way to do it. We don't put a lot of stuff on there, but we do keep you up to date on where we're going to be and what we're doing. And if we have any specials or have any events or anything like that we're going to be doing, we always put it on Facebook. So check us out on Facebook. We're going to be talking a little bit about facial rejuvenation tonight
We're gonna,
with our guest Nora.
Right. Back to you, Nora. When you heard about Dr. Jones through Trinket Parker, and we thank you, Trinket, for referring so many patients to us. And had you done some other research and seen other surgeons?
Actually, I didn't schedule other appointments.
Oh, that's good.
Since I had done so much research online. You were the first one I came to see, and I'm the type of person who I get gut feelings about things.
Yeah.
Once I met you and spoke with both of y'all, and I was comfortable. You answered any questions I could think of. If you remember correctly, I asked about the earlobes because I had a friend who had,
Sure.
you know, her earlobes didn't do well.
Right,
Okay.
right, right.
That was back in New
Good,
Orleans,
good
so it
displaced,
wasn't
right.
anybody here.
Right,
Yeah.
right.
But,
right,
you know, you answered everything.
right, right,
Good.
right.
I just was extremely comfortable, and I liked the way y'all handled everything with me.
Good,
So
good.
I didn't have to go, you know, skipping around town
Well,
to
that's
other
great
places.
praise because I mean I always tell patients that call the first time, I'm like, it's important to I mean get a couple or 2 or 3 consultations and see who you mesh with the best. And most of the time they're going to mesh with Dr. Joe. I'm just saying.
Well, you
'Cause
want to
he's
feel
the
comfortable no
best.
matter what. You
Yeah,
want to feel
right.
comfortable with what you're doing, and the surgeon does too. I mean, we want to feel comfortable with the situation and make sure everybody feels good about the direction that you're going to go in. So that's so important to feel good about it and feel comfortable with that. So
Well, your mannerism is very comfortable, laid back. You're, I won't say slow, but you take your time.
right,
You know,
right,
you don't
right.
make me feel rushed anytime I come there because, you know, we do other stuff at your office too.
Right, right,
But
right.
you don't make me feel rushed. And I always feel special because we do have history now
Right,
with everything
right.
that we've been through with
Absolutely.
the whole procedure.
Mm-hmm.
So, and that's nice.
Oh,
It's nice to
absolutely,
feel
yeah.
like you belong someplace.
Yeah, yeah.
Yeah, we do like to take our time with each patient. Sometimes, if you're waiting, you're not happy. But when you're finally in the room with Dr. Jones, it's all good.
Yes.
But we're very thorough, and you are as well, which is what you want when someone is operating on your face.
This is true.
Yeah.
Very true.
Yes.
Yeah.
So
Kinda important.
The first initial consultation, I remember we, you know, in any consultation we go over your concerns, and Dr. Jones tells you he looks at your face objectively, and and we go from there, make a plan. And what's what we're going to talk about in a little bit when we show the before and afters, the final result.
Yeah, absolutely. So we can go ahead and show some pictures,
Yeah,
tell
let's
what
just
we
get
did
to
and show
the,
some pictures. So we'll go back to the PowerPoint. We'll show a little bit. We'll show the pictures. So what we ended up doing was eyelid surgery, so upper and lower eyelid surgery, and then a facelift, and to really improve the lower part of the face and neck. Sometimes we lift the cheek area, but she actually has very nice, well-positioned
You do.
cheeks, and so
Lucky.
we didn't really need to do a lot of mid-face work or anything like that. But you know, eyes looked a little bit tired, and a little bit of sagging
Right.
in the lower face and neck, and just really just brightened your face quite a bit. And we'll go through some of the other views of the face, and I think the one thing that we always try to focus on is getting a good natural look to the face.
Yes.
And these are, it's been about a year now, hasn't it?
Yes.
I mean, yeah.
End
so
of
these are-
September was a
yeah,
year.
These are
So-
1 year follow-up photos that we got just actually recently in the office. So, so
looks
you can see
great.
the jawline and the neck area, and then the eyes too. Just really a lot of improvement in the eyes. Just look a lot less tired. Really, I mean that's the way that the eyes, when you get the fullness, the eyes like that makes people look tired and really brightens your eyes.
It makes you
and-
feel tired too.
Yeah, yeah,
When you
right.
see yourself like that all the
Exactly.
time.
You see yourself, and other people see you, and they ask you if you're tired and treat you like
Mm-hmm.
you're tired. And
Yeah.
so, but yeah, brighten your eyes so much, really.
really
And the
can.
eyes are the focal part of the face. If you make the eyes look better, the
Right.
whole face looks better. But I think that what we did was the appropriate thing to do to you know, get the improvement that we needed to get to make your whole face look better. I mean, and that's the thing, you know, there's things we didn't need to do and didn't do, and there's things that we did, and we didn't leave anything undone, in other
Right.
words.
Yes.
And I think really made a nice difference. And this
Boy,
is kind
did
of a
it.
close-up of the
Your
face
eyes,
and the
I
eyes.
mean,
It just
everything
really
looks wonderful.
brightens your eyes so much. So,
Really looks
It amazes
great.
me.
I was telling Dr. Jones, you know, if I were to run into you and I didn't know you on the street, I would not go, oh, she had a facelift, or she had a, you know, that's the
Yes.
beauty of your work, Dr. Jones.
I
And
It
appreciate
is
that,
because
yeah.
a lot of women, unfortunately, they just don't have the best surgeons, I guess, and they end up looking really pulled or
Yeah.
done.
Yeah,
You know, I
exactly,
didn't want to look done.
exactly.
I just didn't want to look so tired and baggy.
Right, right, exactly.
And that
yeah.
family trait with the jowls, I was anxious to get rid of that.
Right,
So,
exactly. And that's the
that's
thing. I mean,
wonderful.
the heredity and the family traits. I mean, that is a battle.
Yeah.
I mean, but
yeah, we're a victim of,
right,
of our
exactly.
genes.
We very much are, and but it can make a very nice difference, and again, appropriate and natural looking, and I think
Yes.
that's really, it looks great.
And how long had you been wanting to do this?
I started thinking about it a couple of years before I actually came to see y'all. You know, I have a wonderful husband, and unfortunately, I have to break him in gradually on things because he does not go well with change. Even when it's something with me, I have to kind of break him in.
Right.
So it took a while.
That's not unusual. I don't
That's
think
not
it's
unusual
not
at
unusual,
all.
so,
And also, he loves me. He loves me as I
Right,
am.
well,
And he
that's-
did not feel like I needed it.
Yeah.
And I said, it's wonderful and it's sweet and I love you dearly, but it's not for you.
Right.
It's for me.
exactly.
Anything I've ever done, as far as hair color or nails or clothes, whatever, it's always for me.
Right.
If other people like it, that's wonderful. If they don't,
Too bad.
Don't look.
right?
Right, exactly.
you know,
Yeah.
my life. I'm the one
Yeah.
who has to look at this face in the mirror every morning, so, and I'm very happy
Right, yeah.
with me.
Yeah,
Yeah.
that's wonderful.
But it
Boy,
is so true that husbands, significant others like that, they don't really get it, and
No,
then they don't.
they don't.
But then once it's done, usually they do have an appreciation for it. I mean, they do look and say, "Wow, you look better." I mean, you look good, and they can appreciate it,
Yeah.
but they don't really understand the motives and the whole.
Yes.
They don't really get it.
Yeah,
They
because
just
they don't know how you feel inside yourself.
right,
You know,
that's
what you
right.
see in the mirror is always different from what other people see.
Yeah, we've had
Absolutely, yeah.
patients the night before. The husband's just begging them like, "Don't do it."
Oh no.
Yeah, but so it's so
Wow.
great to have
just-
your
yeah.
family behind you because it's a big
Yeah,
decision,
yeah,
and you
yeah.
want everyone to be with you in your decision.
Absolutely, but he was very
he was.
supportive. I mean,
He's-
you know,
yes.
we worked. I was at the office, came to post-op visits. I mean,
Mm-hmm.
took care of you. Obviously,
Oh, he
he
did.
was very, very
He did
supportive.
wonderful.
So I don't want to say he's not, but like you
Yeah.
said, so you have to. It takes a little
It's
while to kind
slow.
of. Yeah, that's right.
Slow
That's right,
process
kinda
to get
get
'em where I need 'em.
Yeah.
So we're going to take a break, so stay tuned.
Mark Lee's skincare products are based on over 20 years of scientific research with top quality results. Visit Mark Lee's salon in Pensacola to inquire about specialty facial treatments utilizing state-of-the-art skincare equipment and technology. Enjoy one of their many award-winning day spa programs, including the popular 4-hour half-day in heaven. Go to marklees.com for more information. Mark Lee's, science made beautiful.
Your face is the first feature people see. Confidence in how your face looks is very important. When you want natural looking improvement, choose a facial plastic surgeon who truly listens and understands your needs. Dr. Derek Jones, board certified facial plastic surgeon, offers both surgical and non-surgical options to make you look and feel your very best. Call a facial specialist at 484-FACE or visit our website to learn more. Jones Facial Plastic Surgery, where science meets beauty.
Mark Lee's skincare products are based on over 20 years of scientific research with top quality results. Visit Mark Lee's salon in Pensacola to inquire about specialty facial treatments utilizing state-of-the-art skincare equipment and technology. Enjoy one of their many award-winning day spa programs, including the popular 4-hour half-day in heaven. Go to marklees.com for more information. Mark Lee's, science made beautiful.
Welcome back to Dr. Make Me Beautiful. In case you missed it, I am here with my boss, Dr. Derek Jones, double board certified facial plastic and reconstructive surgeon and otolaryngology. That is a mouthful. And I'm here with Nora Wheaton. She's a special guest, and we are talking about her surgical experience. Welcome back.
Great to be here.
That's right.
I want to make sure everybody knows how happy I am to do this, even though they get to see that awful before picture. You don't realize how bad it is either until you see the pictures next to each other. I knew it was bad. You know, my grandchildren would
Right,
play with that.
Right.
But I didn't realize just how bad it was until I saw those pictures.
I think people forget a lot of times. You really don't. You
Tune
really
it out.
forget.
And
what-
the fact
yeah,
that you came
what it
on
used
to,
look like.
to talk about it is great because not everybody wants to talk about it or they don't want
Yeah.
people to know. So really, it's a
Right.
wonderful testament.
Yeah, it really is. So yeah, very natural looking result. We did upper and lower eyelid surgery, blepharoplasty, and then a facelift, which is lower face and neck lift essentially. And you know, again, things that we didn't really feel like we needed to do is forehead lifting. Didn't need brows elevated or anything, just needed to improve the appearance of the eyelids, and the brows are in good position and everything. And then the cheeks, you know, I do mid-face lifting quite a bit, but you've really got well-positioned cheeks and
They
you know,
are, they're
good,
high.
yeah, exactly, good bony
Great.
structure, absolutely. And so really the facelift to tighten the lower face and the neck was really what was important. So, and you can see, again, the improvement in the eyelids for one, and looking at the eyes, and then the jawline and the neck area made a nice improvement. So,
It looks so good.
yeah.
Now, yeah.
A
I
really
have told
nice
a few
injection.
people who have, most people don't ask anything because they don't have a clue.
Right, exactly. And that's the good
It's not
thing.
obvious.
Yeah, it's not so
Yeah.
obvious that they just say, wow, you look like
You look great. Yeah.
went on a vacation. Look,
You're
you
feeling
know.
better. And
Yeah, exactly.
you must have got some sleep.
That's
Well,
right,
Yeah.
exactly.
Yeah, I do sleep better knowing that I'm going to wake up looking better.
Yeah.
Makes a difference
Yeah.
in my everyday life. I'm not unhappy to wake up and see myself in the mirror now.
Right.
Your
Yeah,
eyes,
just-
I mean, I'm just, they look amazing.
Yeah.
What a nice improvement.
That was one thing that has bothered me a lot longer than anything else was the eyes, because they did start drooping probably after 50,
Right.
which I made 60 a few weeks back. So,
Oh, happy birthday.
thank you.
Yeah.
To look at myself and see how I look now, and nobody ever could guess how old I am. But when I was 50, I think I probably looked more 50. But since we did everything,
Right.
somebody
Yeah,
even
yeah.
said something about 48 one time. I said, that works. I can live with that.
Right.
Looks good.
I'm fine
I mean,
with it.
yeah.
So,
yeah, that's the thing.
Well, as far as like the big day, how did you prepare yourself, like physically and mentally? Did you do anything in particular to get yourself ready?
No, I was looking so forward to it.
Yeah.
And we had me scheduled originally for the 27th, I think, of September. And you called a week before and you said, you know, we had an opening on the 25th. You want it? I said, yes,
That's right.
That's
I'm
right.
ready.
Yeah, we got you
So-
in sooner.
I was anxious.
Yeah. But they're great in the surgery center. They really
Yes.
do make you feel at ease.
Absolutely.
And
yeah, very good.
And Dr. Jones has been at the medical center clinic for almost 20
Almost 20. I'm in my
years.
20th year.
Yeah.
Anyway,
Oh,
so,
wonderful.
Yeah.
Yeah, and then
So-
everyone in the surgery center, a lot of them have been down there just as long.
I think we have a great staff. I mean, you know, my
Yeah.
former nurse actually is the OR nurse that we work with all the time. So, and he's great. I mean, he's
That's
so he
nice.
worked with him for years and years and years. So, we have a great staff in the ASC. That's for sure. I mean,
But it
it's
is-
a great facility.
It's outpatient, and you do go home. But as
Right.
far as your post-op journey, is there anything you wish you would have known, or anything you is there anything in your post-op journey that you were prepared for? Or?
The only bad part is that compression bandage,
the
and it's
dressing.
necessary.
Yeah, exactly.
I think it's a wonderful thing that with the way things have progressed in the medical field, you have the tools that you need to make things quicker, easier, less dangerous
Right. Right.
for a patient. And that compression bandage, as miserable as it was for that first day, it was well worth it, I think. And
24 hours. It does its job. I mean,
Yes.
it's, yeah. It's not
Because I
the most
didn't have-
comfortable thing, but right. But then you did great.
I didn't have any problems probably because of that, with any
Yeah.
kind of bleeding or whatever.
Exactly.
And then
Yeah.
once we switched to the other little,
The jaw
the
bra.
lightweight one,
Yeah.
that was a piece of cake after getting
Oh, absolutely,
the compression
yeah.
bandage
Yeah.
off.
Yeah.
Yeah, the jaw bra, I always say Spanx is like Spanx for the face.
Exactly.
But the compression bandage is necessary, and that's on
Right.
for
It's
24
just 24 hours. Yeah.
Right.
Yeah. And I tell people first night's the worst night because you've got to wear the bandage. You just had
Yes.
surgery. You've got drugs on board. I mean, most people actually do pretty well to get through it, and then come back to the office the next day. We take off the bandage, and it's a big relief. So it
It
feels
is.
great.
It's
Yeah.
very
So yeah.
I think y'all do that on purpose. Just,
But it's definitely done
we'll
on
make
purpose.
this part, not comfortable, so that the rest will be a piece of cake.
Yeah. Exactly.
Well, it's meant to
It
keep,
almost was a piece of cake.
Right,
after
right,
yeah,
that.
right.
it's meant to keep the swelling down, correct?
Yeah, absolutely. Yeah, keep it helps prevent any bleeding or
Yeah,
anything like
and
that in
that
the first
too.
24 hours. And I tell people most of the time you look worse than you feel. I mean, most of you
Right.
don't feel that bad, but you do have a little bit of bruising, a little swelling, that kind
It's
of
true.
thing. But
You do look worse
yeah.
than you actually feel.
right. I mean, it's not terribly painful for most patients. I mean, it's, feels tight and that kind of thing,
Yeah.
but
The
uncomfortable,
tightness,
sore. Yeah. Yeah.
It takes a little getting used to.
Right.
But it's worth it because, you do look better right away, even if you have some bruising.
Right.
I don't really think I had a whole lot of swelling.
Yeah, not
I had
bad,
bruising.
actually, yeah.
But that's typical for me. I bruise easy anyway.
Right.
Yeah.
So-
And you had
Yeah.
sent me some photos, which we weren't able to get on the show tonight, but I do have them, and I can always show them to anyone thinking about having facial plastic surgery. A lot of patients say, what am I going to look like the second day or the third day or the fourth day? And you did a progression
Yes, I
of
did.
photos, which I thought was great.
For a year.
You did it for a whole year.
Yeah.
Oh, wow.
Not daily.
Yeah, right,
But
right.
that's neat.
It was every day initially for the first couple of weeks.
Okay.
Right.
And then I went to once a month.
Right. Yeah.
So I did. And I tried to send you the whole thing, but I
Oh,
have
yeah,
issues with
Right, that's okay.
Size of the
my email thing.
files and all that.
Exactly.
Yeah, exactly. Yeah,
And
yeah, yeah.
unfortunately, I am not so computer literate that I can go back and shrink it and send it.
Yeah.
So I'd have had to start all over again.
Right.
Right.
But I do have more if you need more. I have
Well,
more
that's so
pictures.
great because people do ask, so that's good to know.
I'm happy to share them. It's such a wonderful experience,
Mm-hmm.
especially when you start getting a little more distance from the initial thing
Right.
and things settling like they're supposed to be.
Mm-hmm.
You almost forget that you had it done. You just look
Right.
good and you feel good and you're used to seeing yourself looking better. So,
And that's
Yeah.
the way it should be. I mean,
Right.
you forget what you had to go through to get to that point. I mean, it does take, you got to invest the time and the energy and everything
Yes.
else. But again, like you said, you kind of forget about that part of it and just enjoy the results. So,
yeah, because it's really not that awful. Some
Right.
people think it's going to be just an awful experience.
Mm-hmm.
It's not pleasant initially, but it's not awful.
right.
Yeah.
And it just takes the time to heal. I mean, like you said,
Yes.
it just takes a certain amount of time to
Right.
heal. And once you heal, I mean, and then it just gets better and better over time. I mean, and these were, when we showed the photos earlier, they were 1 year follow-up photos, and so looks great. I mean, I tell people it takes at least a couple of weeks to look presentable, and may still have a little bruising then, and then, but then you just get better and better after that. So
Yeah.
it really does.
You have to be compliant, and a lot of people don't want to, do it because they like to exercise, or there's no
Right,
strenuous
right,
activity
right.
for a month. And
Right.
But y'all are the
Take it a
experts,
bit
so if
easy.
you don't listen to you and they have an issue, it's not your fault. I listened to everything that y'all told me to do before and after, and I didn't have any problems.
Yeah.
That's right. That is true. You did. I mean,
So-
definitely did what you're supposed to do, and that's
Yeah.
and we,
And a good
accessible.
girl.
Yeah, exactly. Yeah. And but we are accessible. I mean, you can always get
Yes.
get in touch with us. I mean, Andrea's very good about texting. And
Yes.
Yes,
so
she
it's,
is.
I mean, it's if you need
All the
if
time.
you need us, get in touch with us
Yeah.
because
Oh, yeah.
we're available.
I
So,
texted you a few times for whatever.
Right.
questions
But
here
yeah,
and there.
she
but
usually got back to
absolutely.
me
Yeah,
really quick.
I do. My phone is on 24/7 for the most part, and even on the weekends, patients will text me or contact me
Right.
with concerns, and of course, I can just get with Dr. Jones and say, hey, that's normal, or that's not, or we'll bring you in on as soon as we can. So it's a good thing. So
Yeah,
to
it's
be able
comforting.
yeah,
Yeah.
exactly.
To
have
know
that.
if you need to reach out to somebody, you're there.
Yeah.
Exactly.
Botox emergencies. I'm like, I'm on it.
We're all over it. Yeah, that's right.
Can you come
Yeah.
You get in touch with us.
I need
Yeah.
Botox.
I will work for Botox. That's all. That's all what it
Me too.
boils down to. And then eventually, I'm going to be, just saying, Dr. Jones. But how has your and back to you, Nora? 'Cause,
That's right.
how has your life changed since this?
I feel better. Definitely look better.
You look great.
Even though, I have a few little issues. I'd like to lose a couple of pounds, of course. I know you can't imagine that, a woman who wants to
Don't we
lose
all?
weight.
Yeah.
But as far as the way I look, I feel like I can do anything, go anywhere I want.
Okay.
yeah.
Whereas before I was a little bit more like,
Yeah.
But
Right.
now it's,
Yeah.
bring it on.
Any advice you give to somebody thinking about doing this?
It's a wonderful thing to do for yourself. Don't, I know you have to consult other people usually, especially if it's a woman who wants to do like what I did. She would need to speak with her husband or a close family member, whoever's going to help her, because you do need help for a few days afterwards.
Right.
Yes, you do.
So, it worked out well. I think we did the surgery on a Thursday and or something like that, and my husband was able to stay with me, and he took care of me. He did a great job.
Yeah, he really
I'm
did.
very
he
proud of him.
did.
Yeah, he
Yeah.
did.
Very,
we
very
we
good
are
job.
proud of him.
Yeah.
So.
But you need to speak to somebody about it to help you.
Right.
Because of, obviously, too, you can't drive home.
No.
after
Well,
you
yeah.
had this
You have
done.
to have somebody.
So
Bring
you have to have
stay
somebody
there,
to
take you
you.
home, all that kind of stuff. Yeah,
Yeah,
for
but
sure.
it's a wonderful thing to do for yourself. Don't do it for somebody else, do it for yourself.
Yeah.
Right.
Because you're the one who has to go through it, and you're the one who has to live with it permanently.
This is true.
So,
Yeah.
and it does so much for you.
Yeah.
It really does.
And it's a permanent change. You always
You'll always look better than you know as time goes on. I tell people, and it's true. I see people sometimes that are in their 80s and they don't look like they're 80, and they had a facelift, 20, 25 years
Yeah.
before, and they still look pretty good. I mean, it definitely makes a difference, and it is a permanent change. So, yeah.
So we're wrapping it up. We ran out of time. So thank you so much for watching. Good night.
Good night.